The Integrated Parkinson's Care Network tries to bring, I would say, simple but very important values to Parkinson's care. Briefly, what we'd like to achieve with this IPCN is optimize care integration, but also, in a way linked to integrated care integration, self-management support. So supporting people that live with Parkinson's disease, I should say, that live more empowered and in a way more autonomous, so that they can anticipate what will happen to them and in a way be more comfortable in managing the issues and I would say the care needs that they have on a daily basis. So based on that, what we tried to do in Ottawa was to, in a very pragmatic way, first build what I call a virtual multidisciplinary clinic. So this is kind of a network that ultimately we try to optimize existing healthcare resources by knowing better which are resources available, but having a better communication and connection with these different resources that ultimately allow for a better navigation of the healthcare system and a streamlined referral pathway. That's one aspect. And then also we developed a curriculum for a care integrator that ultimately is someone with a nursing background and, of course, with training in Parkinson's disease, but also is trained in these aspects of shared decision-making and self-management support. And it's really the pivot of the network. And so in the pilot study, what we've done, it's definitely not looking at efficacy or effectiveness, but really looking at how feasible is to deploy this network and ultimately what's the feedback we get from key stakeholders. So patients, care partners, the Parkinson's community, but also the different members of the network, some healthcare professionals, again, to see if we have some signals of viability and then can proceed for further evaluation. And so that's what we also currently doing actually in the international project. It's called iCARE-PD. And we're kind of testing these kind of values and premises of care in Parkinson's disease in completely different realities. So we have centers from France, Italy, Portugal, Czech Republic, Ireland, and Germany, where realities you can see that are quite different. So our goal is to create this toolkit that we can deploy across different geographies, different realities, to ultimately bring better care for patients with Parkinson's disease in a viable and economically sustainable way.